This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks for joining us for USVI News. I'm Emily Matson. Health leaders here in the VI are warning residents of an alarming and significant uptick of COVID cases in St. Thomas. Over the past few days, there have been 43 new positive cases of COVID-19 reported in St. Thomas. The Department of Health says the cases are among unvaccinated individuals. There are more than 100 positive cases currently, with 10 in St. Croix and 5 in St. John. The surge in St. Thomas, they say, could have been avoided with vaccinations. So a reminder, there are several options for getting vaccinated here in the VI, with pop-up events happening across the territory through private providers and, of course, through those community vaccination centers. To schedule an appointment for the COVID vaccine, you can call 340-777-8227 or visit covid19usvi.com/vaccines. Now, you can walk in to those community vaccination centers, but give a call for an appointment if you wish. So how did COVID-19 start? That's still the big question, with theories instead of answers at this point. And President Biden wants U.S. intelligence agencies to re-examine COVID-19's origins. Some government officials suspect the virus may have come from a lab in Wuhan, China. It's a claim, though, Beijing has denied. Mr. Biden ordered a report within 90 days. And we have some very good news for travelers. Cruising is coming back to the U.S. next month. Celebrity Cruise Lines has been cleared to sail from Fort Lauderdale in Florida in June. The Royal Caribbean Group's owned company's inaugural post-pandemic journey departs June 26th on the Celebrity Edge. It's not yet known what the ports of call are going to be. The Centers for Disease Control and Prevention requires all cruise lines to complete trial cruises that replicate real-world conditions or require 95% of the passengers and 98% of crew members to be vaccinated against COVID-19. Celebrity has opted to require vaccination proof for all crew and passengers over 16 years old. Meantime, the CDC says it's investigating after a small number of teens and young adults reported having heart problems after being vaccinated for COVID-19. At least 18 of those have been reported in Connecticut specifically. Experts say the cases appear to be extremely rare at this point. Jamie Ratcliffe reports.
Is it a coincidence or related? That's what the CDC and health officials are trying to find out after receiving reports of inflammation of the heart muscle known as myocarditis following the COVID-19 vaccine. According to an advisory committee group, there have been relatively few cases and most appear to be mild. It's mainly in adolescents or young adults. The agency says it happens more often in males than females and more often follows the second dose than the first. It typically occurs within 4 days after vaccination.
We've seen 4 patients, and keep in mind that's out of some 50,000 patients that were vaccinated. And so those are 4 patients under the age of 21.
Dr. Jeremy Asnes is the Yale New Haven Children's Hospital Heart Center medical director and says all 4 had mild cases, did well, and went home.
If there's in fact a connection, it's going to be incredibly low, very rare. We've vaccinated millions of people, millions of kids, and this is only a small signal, a handful of cases that have occurred in the United States.
Dr. Juan Salazar is a physician-in-chief at Connecticut Children's and says myocarditis is something they see in kids, though it's rare and usually due to a viral infection and more common in the spring and summer. And while the CDC continues to investigate whether there is a connection between myocarditis and the vaccine, doctors we spoke to say it's still recommended to get vaccinated.
I would still recommend vaccination because the risk of disease is much higher than any potential rare, incredibly rare side effect associated with a vaccine.
The feeling is that the benefits of being vaccinated far outweigh the very small potential risk of getting myocarditis.
So in terms of symptoms, parents should be on the lookout for severe chest pain, shortness of breath, fatigue, or weakness. Reach out to your doctor if your child experiences any of these symptoms following the vaccine. A new study shows about 90% of people who recover from COVID-19 have antibodies in their systems for about 10 months. LabCorp researchers studied almost 30,000 patients for up to 300 days. They tested participants for 2 coronavirus antibodies, and they found they didn't decrease much in that time. The study is out this week in an open access journal from Lancet. And another recent poll shows that more Americans are returning to normal life and leaving pandemic safety measures behind. A little over 1,100 adults were polled between May 21st and May 24th. The researchers say for the first time since it began, fewer than half of Americans say they socially distanced in the past week. Also, 45% said they wear masks at all times. That's a decline from 58% from just 2 weeks ago. However, most did not trust people outside of their close circle to be honest about their vaccination status. Memorial Day is fast approaching, and it'll be a milestone here in the U.S., the first major holiday with a COVID-19 vaccine. And while that'll mean normal celebrations for so many of us, experts caution it's still important to be safe.
It's the unofficial start to the summer, and this year, for many, Memorial Day also marks a return to travel, get-togethers, and group fun.
Put that shot in my arm for a reason, so I could get back to normal.
Some 37 million are expected to travel this coming weekend, a big bounce back from last year's COVID-ravaged holiday. But some are understandably anxious.
We're going to do so dipping our toe in the water and having everybody move at their own pace.
And that's okay, according to health experts who say while at least 50% of American adults are fully vaccinated, things are not 100% safe.
This pandemic is not over. It is just going into a different phase.
Cleveland Clinic infectious disease specialist Dr. Frank Esper recommends outdoor activities like backyard barbecues and picnics, especially if gatherings include kids or other unvaccinated individuals. If traveling, remember masks are still required on public transportation and planes, and don't drop the good hygiene habits practiced during the pandemic like hand washing.
We should really think about how good we have it right now. Where we are right now is a very good place, and think about why we've gotten here.
And while there are few restrictions on travel within the U.S., if you're going abroad, make sure you read up on your destination and be prepared to possibly show proof of vaccination or a negative COVID test. A new normal for the summer holiday season amid a new phase of the pandemic.
The CDC is recommending unvaccinated Americans avoid travel. However, if they do, the agency advises them to get tested before and after travel and to socially distance from those who they do not live with. It is another big weekend of soccer here in the territory with free soccer clinics for youth territory-wide. And it's all made possible through the USVI Soccer Association. Here at the last clinic in Oswald Harris Court, several aspiring soccer players came out to receive training and coaching. Meanwhile, kids on St. Croix hosted their Born Soccer Clinic with lots of drills, instruction, and of course fun. And there's a big push to get more youth involved in soccer and make it easy for any child to participate.
It's pretty awesome. It's good to have an outlet for the kids, especially on the weekends when you're trying to find an activity. So I'm enjoying it so far, so good. Yeah, I think my son would love this. He don't get out much. He loves to run up and down, exercise his legs, so he would love this.
What are some of the things that you're doing?
I'm kicking the ball. I'm having a lot of fun. That's what my thing to do.
What makes soccer fun?
The way how you like kicking the ball, it makes it more fun for you.
It's very much important for them to have an outlet, a time to come outside because they spend so much time in their electronics. So I'm very much appreciated. Yeah, I appreciate it as well. The phones, oh my gosh, it's time to get out of it. Open the fields for these kids. I appreciate this.
For sure, get their faces out of the phones and out on the fields. Here's a look at details for this weekend's as well as upcoming soccer clinics. On Saturday on St. Croix, a clinic will be held in Estate Prophet at 10 a.m. And in St. Thomas, the clinics at BCB Middle School also at 10 a.m. All mask and COVID safety protocols are going to be in effect.